What are the most common side effects of omeprazole, prilosec? The most common side effects of omeprazole include a significant prevalence of respiratory system disorder, notably in infants, 42%, children aged 1 to less than 2 years, 75%, and adolescents, 19%. Within the 1% to 10% incidence range, dermatologic effects manifest with skin rash reported in 2% of cases. Gastrointestinal effects within this range encompass abdominal pain, 5%, constipation, 2%, diarrhea, 4%, flatulence, 3%, nausea, 4%, and vomiting, 3%. Nervous system effects in the same incidence bracket include asthenia, 1%, dizziness, 2%, and headache, 7%. Additionally, neuromuscular and skeletal manifestations account for back pain at a 1% incidence. Respiratory effects in this range involve a 1% incidence of cough and a 2% incidence of upper respiratory infection. The most common side effects of omeprazole include various cardiovascular effects, including acute coronary syndrome, Kounis syndrome, angina pectoris, bradycardia, chest pain, increased blood pressure, palpitations, peripheral edema, and tachycardia. Dermatologic postmarketing effects encompass a range of conditions such as acute generalized exanthematous pustulosis, alopecia, cutaneous lupus erythematosus, dermatitis, hyperhidrosis, hypertrichosis, maculopapular rash, pruritus, skin photosensitivity, Stevens-Johnson syndrome, toxic epidermal necrolysis, urticaria, and xeroderma. Endocrine and metabolic postmarketing effects involve the most common side effects of omeprazole, such as galactorrhea not associated with childbirth, gynecomastia, hypocalcemia, hypoglycemia, hypokalemia, hypomagnesemia, hyponatremia, vitamin B12 deficiency, and weight gain. Post-marketing gastrointestinal effects encompass abdominal swelling, anorexia, benign polyp of the stomach, clostridioids, difficile-associated diarrhea, colitis, microscopic, dysgeusia, esophageal candidiasis, fecal discoloration, gastric polyp, fundic gland, gastroenteritis, irritable bowel syndrome, pancreatitis, stomatitis, tongue mucosa atrophy, and xerostomia. Genitourinary post-marketing effects include erectile dysfunction, glycosuria, hematuria, microscopic puria, proteinuria, testicular pain, urinary frequency, and urinary tract infection. Hematologic and oncologic post-marketing effects involve agranulocytosis, anemia, including iron deficiency anemia, hemolytic anemia, leukocytosis, leukopenia, neutropenia, pancytopenia, petechia, and thrombocytopenia. The most common side effects of omeprazole include hepatic post-marketing effects encompass cholestatic hepatitis, hepatic encephalopathy, hepatic failure, hepatic necrosis, hepatocellular hepatitis, and hepatotoxicity, idiosyncratic. Hypersensitivity reactions in the post-marketing realm include anaphylactic shock, angioedema, and drug reaction with eosinophilia and systemic symptoms. Post-marketing nervous system effects span abnormal dreams, aggressive behavior, agitation, anxiety, apathy, confusion, dementia, depression, drowsiness, fatigue, hallucination, insomnia, myasthenia, nervousness, pain, paresthesia, sleep disturbance, tremor, and vertigo. Neuromuscular and skeletal post-marketing effects include arthralgia, bone fracture, lower leg pain, muscle cramps, myalgia, and systemic lupus erythematosus. Ophthalmic post-marketing effects involve anterior ischemic optic neuropathy, blurred vision, diplopia, dry eye syndrome, eye irritation, optic atrophy, and optic neuritis. Otic post-marketing effects include tinnitus. Renal post-marketing effects encompass acute interstitial nephritis and chronic kidney disease. Respiratory post-marketing effects include bronchospasm, epistaxis, pharyngitis, and pneumonia, community-acquired in pediatric patients 4 to 36 months of age. Lastly, miscellaneous post-marketing effects consist of fever. The most common side effects of omeprazole include a range of diverse manifestations affecting various systems in the body.